Thank you. Well, we really have to move on to our third bin, which is non-biological solutions. Do we have something as brilliant? Okay, good. I have quite a broad miscellany of items under this heading. I thought we might start with AGI as a tool for accelerating discovery of all kinds across the gerontological anti-aging spectrum, and that's Peter Voss.
I think what I'd like to ask here, I mean, I have a roadmap to developing AGI, as I, briefly mentioned yesterday. I have a little bit more of a detailed roadmap for that with funding and all of that. But, and I assume we'll be talking about that later or tomorrow. But what I'd like to ask here in particular, specifically, what ideas are there for early use of a relatively dumb AGI for the researchers here, so that we can, as soon as we can actually ramp up our R&D again on AGI, that we could actually direct some of our R&D specifically, or most of our R&D specifically to this purpose. So it's still early days to discuss that, but I'd like to work towards, within 2 years, of having something like a research assistant, and I'd like to ask people here, and maybe we can take it offline, we don't want to take too much time on this, to come to me and tell me how useful would it be if you could have 1,000 researchers that you could give some instruction how to find stuff or what to filter, or to, in English, you could train them, we could help train them, and they could basically do stuff for you.
I've got one very specific suggestion which applies to quite a lot of the things we've been talking about here. Analysis of genomic data, and also proteomic data, but especially genomic data, is something that is really in the dark ages in terms of predicting function from genetic sequence. We often hear about the protein folding problem as something that is very difficult in terms of predicting structure, but predicting function is something that we ought to be able to do today a lot better than we do, because it's, of course, done very much by looking at homology, looking at sequence similarities of various types. Now, at the moment, we're in a situation where what you get out of databases that purport to talk about homology is extremely unreliable, and it's unreliable for reasons that I think are not easy to address using conventional computing resources, because they do require some degree of intelligence. So I would very much like to see emerging AGI-like engines such as yours being applied to that problem. It would be something that would have applications across the whole of biology, and certainly across everything many of the things we're talking about here.
And systems biology and bioinformatics.
Right. That was an excellent beginning to this segment. Next on my list, I have artificial organs. Anyone want to discuss artificial organs?
There's a lot of work going on that, and I'm sure that more money to make it go faster for more and different organs. Strategically, I know they're working on heart, but you'd really want to do heart, maybe lungs, maybe liver, the organs that have holes in them, essentially, and working out how to inkjet print, effectively, cells to produce those organs. And there are two aspects of that. One is producing the quantity and types of the cells that you need. And actually, I think Mike West's work might apply to that to some extent. And so you basically want to have I'll use pristine, but they don't really have to be pristine for certain applications. Vats of cells that the inkjet printer is attached to that print up the organs the same way you would basically synthesize DNA or synthesize proteins, only doing it in 3D like the 3D printers that now do it in plastic, quite large.
Greg, did you want to?
Yeah, I would say that there are a number of companies that are out there working on this sort of thing already, and they tend to be small and struggling and could benefit from having people give them cash infusion so they can get over their problems. We're starting to work at a local company called HepaHope. They've been working on a bioartificial liver for a number of years, and they're hoping to overcome FDA objections and start clinical trials next year. HEPA-HOPE. They're actually a good group of people, and we're hoping to synergize with them because they're really excited about us banking their artificial livers for them, and we're real excited about having something to bank. So it's a good partnership. There's also a guy named David Humes, I think at the University of Michigan. He's developed the renal assist device, and he's just going along on a shoestring. They tried to set that up as a commercial enterprise several years ago. Everything was jazzed up, and SmithKline Beecham invested a bunch of money in them, and then it just all collapsed for some unknown reason. But it's still moving along, and that's actually saving patients' lives today. That's the only one I know of that's actually doing that right now. It's another example of an area where progress is moving forward, but slowly, and a little push could really make a big difference.
Thank you very much. Other biomedical devices on a macro scale beyond organs?
Sorry, I'd just like to add one thing that it just occurred to me. I probably didn't make it as clear as I should have. I would actually specifically like to suggest to researchers in this field that if you can think of some research project over the next 2 years that would benefit from, 100 or 1,000 undergrads doing some work for you, low-level human internet searches, calculations, tabulation, no new AI technology as such, but rather thinking of it in terms of what a low-level human person could do. But if you could have hundreds or thousands of them available to you, and if you can actually factor that into your research proposal, something that you wouldn't consider doing because the cost would be prohibitive, please let me know, because I do believe we are only a few years away from being able to offer that.
Thank you very much. Any other macro biomedical devices people would like to discuss?
The device that I've been waiting for 30 years is the artificial pancreas. And that's probably the #1 target organ besides the heart because of the incidence of diabetes. The devices that are out there now, I have one patient on an artificial glucose monitoring unit, and it is really difficult. I thought it was the answer. It's not the answer. He's a programmer, and I think it takes a program to learn how to use these. That's what we've been waiting for. We've been waiting for 30 years for the artificial pancreas. I don't know anybody who's doing the research on this. Somewhere there is some research being done.